Hello there. People often ask me that where are antibiotics in your Ayurveda? Is it the turmeric that we can use as an antibiotic? And how do you guys treat infections when you don't have any antibiotic? Antibiotics are actually indeed like a very hallmark development in modern medicine because it works often very dramatically, and in the cases where patients are severely ill, antibiotics come up as a boon. So the basic difference between Ayurveda and the modern antibiotics is the approach. Like uh, in Ayurveda, we don't focus on the microorganism or the pathogen which is causing the disease. We are actually focused on the environment to make it unsuitable for the pathogen. So, for example, if a patient is suffering from recurrent urinary tract infection, so how do we treat it in modern medicine is that we will identify the organism and choose a drug which is specific for that organism to kill that one, and we will give that drug to the person. But often it happens that the recurrence is there, and sometimes even the patient becomes not exactly the patient, but the microorganisms in that patient become resistant to that particular antimicrobial agent, which is the antibiotic. So, in such cases, often the modern medicine goes into a fix, and mm, doctors don't know how. I mean, they are well learned, but they often get a little stuck over here that how to approach patients with resistance. But in case of Ayurveda, we focus on the quality of the humor. So when it is urinary tract infection, whereas in modern medicine, this concept of the quality of humor, the microbiome concept, which is a part of how Ayurveda thinks, is in a very nascent stage. We have just, in modern medicine, we have just begun to think about the urinary microbiome. They have been predominantly focusing on the gut microbiota. The urinary environment is a relatively new concept here, but in Ayurveda, all the humors have a kind of ideal quality which needs to be maintained. And whenever it gets altered, the microorganisms, it is not that Ayurveda does not know about any microorganism, but the thing is that only then the microorganism gets the chance to affect the individual. So it's like it is very similar to the dysbiosis concept of modern medicine, where the microbiota present in the humor are competing with the invading pathogens to cause the. I mean, the pathogens are competing with the microbiota to cause the disease. The environment of that particular humor or the organ is changed, so it is very similar to that. So Ayurveda believes in having a certain standard quality of that humor, and any disproportion in that quality is represented by the altered proportions of Vata, Pitta, Kapha. It's a very different approach, which is, I think, very unique in its way. So whenever a patient comes to us for UTI, we'll look at the symptoms. We'll try to correct the humor only. That is our job. We will not be putting any effort to recognize the microorganism and to give a specific antibiotic to that person. We will correct the humor, and once the humor is corrected, the microorganisms will go on their own. So we don't like. I think Ayurveda is very a cool kind of medicine. We don't do a lot of reductionistic things. We keep it very simple, and it works as well. And the similar is the case with the rhinosinusitis. The sinus has its own microbiota, as we think in modern medicine. As I have already explained in my previous videos, we don't identify the microorganism which is present in the sinus fluid. In some cases, in serious rhinosinusitis patients, even the sinus fluid is sent for the culture when the routine drugs fail to bring any benefit to the patient. So even in those serious patients, an Ayurvedic doctor will focus on the quality of the humor, like in what proportions the pitta, kapha, and vata is altered, and will act accordingly. And once the humor is corrected, the microorganisms will go on their own. Like they won't be able to survive there anymore. So it's about maintaining the balance of the humors and not targeting the specific microorganism to kill it, because in the long run, as we all see, though antimicrobial agents are working very good, and all of us have used it, but in the long term, as it is being seen because of the wrong use by the society, increasing cases of resistance are coming up. So at least in Ayurveda, we won't have that, because we are working on the quality of the human. We are not making very strong chemicals to kill the specific microorganism. So this is how the antibiotic concept does not exist in Ayurveda, not because we don't know about it, but because we don't work it in that way. Thank you.